Welcome to County Executive Mark Eldridge's weekly press briefing. I'd like to thank you all for being here today and joining us for this week's conversation. Reporters, please remember if you have questions to please put them in the chat and list the news organizations that you're with. If you would like to record, please put that in the chat as well if that has not connected so far. Joining us today, we have, joining the county executive today, we have Dr. James Bridgers, acting director of the Health and Human Services Department. We also have Dr. Keisha Davis, our health director, Dr. Earl Stoddard, who is the assistant chief administrative officer, and as well as Sean O'Donnell from the health department as well. We have a special guest today. We have joining us Ronaldo Santiago, who will be here talking with us today a little bit about mental health, since this is Mental Health Awareness Month. We're going to kick off the conversation today, as always, with the county executive providing us with some opening remarks. So, Mr. County Executive, handing it over to you.
Thank you very much, and good afternoon, everybody, and thank you for joining us again. I want to start by applauding the effort Monday to protect school-age kids from fentanyl by giving students in Montgomery County Public Schools permission to carry Narcan, the overdose antidote, on them in order to protect friends and classmates. It's not the only tool that's being used in response to a spike in overdoses among minors that drove a 90% rise in opioid-related emergency room visits last year. In a moment, you're going to hear a little bit more about our efforts to address the opioid fentanyl issue in the community. But this opioid fentanyl issue is fundamentally a mental health issue, and that's the issue that we really need to be addressing. On the prevention side, we're committed to programs and working with community partners to address behavioral health and mental health issues. May is Mental Health Awareness Month, and statistics provided by the National Alliance on Mental Illness show that 1 in 20 adults nationwide, 1 in 20, experiences serious mental health illness each year, but less than 2/3 of them receive treatment. In fact, it can be years before someone who shows signs of mental illness receives the treatment. Drugs can be a way that some use to dull the pain and that some people are experiencing. But as we've been saying all year, one mistake with fentanyl could be deadly. I've got to say, this is very different than most drugs that have circulated in the community. We've had issues with addiction before. People got addicted to speeds. They got addicted to uppers and downers. People rarely died. This is now something where people are doing things that kill them. And we really need to step up both the education on the lethality of what they're playing with, but also on the mental health issues that underlie that. So I want to bring on Dr. Santiago, who is the Chief of Behavioral Health and Crisis Services for HHS, to talk a bit more about the effort to stay on top of this issue as we move closer to the summer and the end of the school year. So, Dr. Santiago.
Good afternoon, and thank you for inviting me to give an update on the current and future plans for addressing the opioid and fentanyl issue that is affecting too many residents and their families here in Montgomery County. Everyone has heard in the news over the past several months that Montgomery County, like many communities across the U.S., are seeing an increase in the number of overdoses due to fentanyl. Currently, more than 80% of all fatal and non-fatal overdoses are due to fentanyl. It's become the opioid of choice for some, and for others, it is contained in what may look like a typical opioid, such as Percocet, and in pills manufactured to look like Adderall or other prescription medications. Our adolescents and young adults have discovered fentanyl too, and that is extremely concerning. Hospital emergency departments in the county are seeing a rise in visits related to opioids, and in some demographic groups, the number of visits has doubled. We at the Department of Health and Human Services have been looking at the problem with a three-pronged approach. One, through a primary prevention approach. This is about helping kids build up their resiliency and their life skills to keep them from starting to use opioids. Two, we're looking at the problem through a secondary prevention approach. For example, using harm reduction practices for those who are already using substances, such as distributing fentanyl strips to them to test for the presence of fentanyl in substances that they're already consuming, but also increasing access to treatment. Three, we are using a tertiary prevention approach, which means preventing and reversing overdoses through the use of Narcan, as well as increasing access to Narcan and Narcan training. We have plans for creating a fund to pay for treatment costs for young people who are uninsured. We're also working to build up the capacity in our child and adolescent assessment services at the crisis center so we can help kids and parents find treatment resources. And we're developing a medication-assisted treatment program for adolescents 17 and younger. Medication-assisted treatment is an alternative to going cold turkey by helping to manage acute withdrawal symptoms as well as long-term cravings. It is used less often with a younger population, in large part because of a belief that they shouldn't be on long-term meds. The reality, however, is that fentanyl addiction is so strong that in most cases, recovery without medication-assisted treatment is a setup for a relapse. A recent change now makes it possible for any healthcare practitioner with a DEA license who can prescribe buprenorphine, but very few are doing so. So we're also working to educate Montgomery County clinicians about MAT, medication-assisted treatment, so they will be more willing to prescribe it. We're putting a particular focus on working with vulnerable communities to educate parents and others about fentanyl and providing information on resources available in the county. We continue to offer Narcan training to groups, both large and small. Montgomery County is getting more than $4 million from the state's opioid restitution fund, and our opioid intervention team is working to determine how and where we will use those funds to further our efforts. The Department of Health and Human Services is a key player in addressing this issue, but we're not in it alone. There are strong partnerships, both internally in Montgomery County government through law enforcement, the school system, and the judicial system, and throughout the community with treatment providers such as Maryland Treatment Centers and Suburban Hospital and the Journeys program at Maryland Treatment Centers, as well as our hospital partners. Another key component of our efforts are nonprofit partners such as Montgomery Goes Purple and the Collaboration Council for Children and Youth. So this is a brief snapshot for our current efforts, and we have much more work to do, but I believe that we as a community can help stop the ravages of this drug and help make everyone safe and healthy. Thank you.
Thank you. Any questions from anybody?
I see Tom Fitzgerald's hand is up, and I'm not sure of his question.
I think his question's for the next round.
Okay.
Are there any questions on this topic?
It's off topic, yes, Barry.
All right, we can come back to you on that.
Heather?
Heather, do you have a question on this topic?
I do. Thanks so much for taking it. I'm wondering, County Executive, you talked about, a lot of people using drugs to ease mental illness symptoms and pain. Do you see any correlation between, is there any evidence to back up that kids now who have experienced so much trauma in the last few years are now just unable to cope with it and, using fentanyl? And is that the reason that you think that this has really been exploding recently, especially among children?
I think it's really complicated, and that I start out, not only am I not a doctor or a psychiatrist, I don't play one on TV. So I'll be careful about what I say.
Sure.
I will say that, people's original involvement with fentanyl started with fentanyl substitution into existing drugs unknown to people. So people thought they were taking one drug and wound up taking something laced with fentanyl and wound up dying because they had no idea what they were taking and the effects. It was a process where there was no standardization of the production of illegal drugs to keep them safe. I mean, they were just made and put out in the street, and people didn't think too much about it. People didn't care what the results were, frankly. That's a problem. I think that, and I've been talking to some younger people, including my own grandkids, about this, who both live here, or two of the four live here right now. And it's really concerning, their perceptions about community and disconnection and, a combination of things. Kids talk about climate change, and I'm not saying that, in a political sense, but kids are really worried about whether this place is going to be around when they grow up, or is it going to be a place where they can live in? There are a lot of children, my kids happen to be kids of color, who are really concerned about race relations and, don't see improvement. And I got to say, that's a lot different than in my own life. I could look at 1960 and look at 1980 and feel like, my God, we come, a ways from 1960. And a lot of kids now don't feel if we're going in any direction, we're going in the wrong direction. And you add to that, the uncertainty of this, the war in Europe and, having somebody constantly threatening to make it global. And I think everybody understands what a nuclear war would look like if it went global. Anybody who thinks you're going to contain a nuclear war is an idiot. I'll just put it out there, and the Defense Department people can debate me all they want. It's insanity to think about nuclear war. So, and I think a lot of kids know it's insane. So I think you've got a lot of pressures, and then you've got this disconnection. You have 2 years of not socializing with people, which in young people, when you consider they're still growing as teenagers, their brains are still maturing as teenagers, that they missed 2 years of what would have been normal social emotional development. So you add that to losing 2 years of school and then being thrown into a blender where you're 2 years behind. You are now, say, in 10th grade. The last decent education you had was when you were in 7th or 8th grade, and now you're expected to do 10th grade work, having missed a lot of stuff that fits in between. And that is not a confidence builder for a lot of people. So I think you've got a lot of things which, frankly, we don't all control. Not all of it is due to malevolence or anything, but there's a lot of things that have piled up on these kids that I think make it really hard. And I think young adults, not just kids, feel the same strain. You can be 21 or 22 and wonder what's the future hold. I've had talk to people who said, I'm not having kids. I'm talking about young people. There's no way I'd bring a kid into this world. Well, what kind of world do you think you're living in that you wouldn't be willing to bring a kid into? It's not just a statement on childbearing. It's a statement on the world you view around you and what you think is doable in that world. So I think there are a lot of distressing things happening. I'm sorry it's not a simple answer, and I have no clinical words or drugs to prescribe, but it's a problem.
Very, very understandable. And Mr. Santiago, can you talk a little bit more about this medication-assisted treatment program and, when that may be able to expand? And I know you're trying to raise awareness about it because a lot of people probably don't know about it.
I'll make some comments and then I'll ask my colleague, Dr. Keisha Davis, to also elaborate. But this is kind of newish, as I said in my remarks. It's not something that is typically done with youth, especially 17 and younger, because we don't want to get them into using a lot of medications. However, we believe that the crisis amongst the youth is real, and that they're experiencing real addiction to fentanyl, and withdrawal is very painful with the kids. So we need to try medication-assisted treatment, which would be an alternative, right, to using the drugs. In terms of outreach to providers that could do this, let me pass it on to Dr. Davis. She herself has had experience. She's a physician, and she can talk a little bit about what our projected efforts are.
Thank you, Dr. Santiago. So as many of you know, I'm a family physician, and when I was in my private practice, I was a prescriber of buprenorphine, and always will be a big proponent of this being done in primary care offices by folks, family physician or pediatrician in the case of our youth and adolescents. There were a lot of restrictions on providers being able to do that. You had to have a special license, you had to go through special training, and the FDA has removed a lot of those barriers. And what comes with that now is creating the education and awareness that docs need to be able to take part in this. You know, part of the benefit of buprenorphine is that it helps, Suboxone as it's commonly called, is that it helps folks to live a more normal life in controlling the cravings. And the addiction that we see with fentanyl is so much stronger than what we see even with other opioids, that it makes it really difficult to just do that cold turkey without the additional supports of medication. And so being able to have someone get started and then continue to follow up with their primary care physician and continue to get those wraparound supports can be really effective as a strategy to increase the number of providers and access for patients when it's limited to just a handful. And right now we really have just a handful of people who are willing to prescribe that really can make it challenging for somebody to get in the door. It allows that ability to be done in conjunction with the rest of their medical care. And when we think about the integration of behavioral health and primary care and behavioral health and physical care, physical health, having those two really better interlinked and intertwined is good for everybody.
Thank you so much.
Okay. Any other questions? If there are no more questions for Dr. Santiago, thank you very much, sir, for your comments and answers. And you can go now if you would like.
Okay, thank you.
All right.
You're welcome. Have a good one.
All right. Now we will turn it back over to the county executive who will go to the second half.
So I don't know if it's the second half or is this soccer and this is the second period of 3. So in this second period here, hold on a second. Should not be doing this. Okay. So I want to do a little brief update on the planning board. On Tuesday, the council selected Artie Harris to lead the planning board, and Josh Linden was appointed as a planning board commissioner. I'm going to be meeting with both of them to talk about perspectives and how we create a more equitable, inclusive, and thriving community through the planning process. Our planning board plays an essential role on a good day in shaping what our county will look like and feel like. So having a board that's committed to ensuring our diversity is front and center in their planning decisions, I hope. I look forward to talking with both of these candidates and learning more about them and their vision for Montgomery County. For those of you who don't know Artie, and I do have a history of working with Artie, he has a long history in planning and developing affordable housing in the county. He spent the last 15 years with Montgomery Housing Partnership, which just this year made its largest investment of more than $100 million to preserve 200 affordable units in Forest Glen. I think Artie has both the practical experience and a background to help us move forward. And as we continue to preserve, protect, and produce affordable housing, we have to remember that our focus has to be affordable housing for the workforce that we have today. There are just tens of thousands of people who aren't even eligible for our affordable housing programs, and there are projected to be tens of thousands of people who will arrive here for jobs, but will arrive for jobs that will pay so little that they won't qualify for housing in Montgomery County, or at least affordable housing. And we've got to make that thinking front and center in terms of what we do. And I'll say it, I know I'll upset some of my friends out there, but I think it's delusional to say that if you just build more housing, you will solve the affordable housing crisis. It's simply not possible. That's not the way this works. And, the most optimistic projection is you build more housing and older units get cheaper. They may get a little bit cheaper because they can't compete for amenities, but going from a little bit cheaper for units that are already not affordable to people down to the level of affordability that people need is not something that's going to happen. And where that does happen, the housing, you wouldn't want to live in the housing. So there are real issues that, I think we have to confront, and I hope this next planning board is willing to confront. We have to be very careful about what we do. We've got to modify our affordable housing policies to make them more inclusive. We need the planning board to be a partner in this. We need to require more affordable housing to be built, and we have to prevent the loss of existing affordable housing. That was one of the really nice things about the development in Forest Glen that Artie was a part of. They not only are replacing all the units that were there, but they're adding more than 100 additional units, so that this will be a massively affordable housing project that does not come with a loss of what's already on the ground. I'm a believer that, when you're in a hole, you need to stop digging. And, I think Artie's position to do that is also going to be the first African-American chair of the planning board. And I think that's going to be helpful. I'll note that the racial equity analysis of Thrive that was provided for the council by a contractor that the council hired said the Thrive wasn't equitable, and it did not listen to the communities of color. So hopefully that's one of the issues that Artie can take up and make sure that as they move forward, trying to implement whatever they implement, that they do listen to and consider the people who live here in the very diverse community that makes up Montgomery County. On another front, the council passed the late night safety bill, and I want to thank them for doing that. They made some amendments to what we had originally proposed. I think the bill's fine. And it asks businesses that are open past midnight and in high priority areas close to other late night establishments to develop safety plans. These plans can include things such as adding security staff, enhanced lighting and surveillance cameras, and other tools to help deter crime. Council also added some amendment that strengthened the bill. The legislation now involves more departments, not just the police. This will enable us to take a more holistic approach. The goal of the bill is to improve safety for residents, visitors, and businesses, and I believe this is going to help. In February, I stood with police, council members, and downtown Silver Spring business owners in pushing for this change, and we've been testing this policy, and it's been working. Now I'm excited to see that we're going to be expanding it countywide. As a longtime community activist, I know how important it is to involve the community, so I want to commend the Silver Spring community for continuing to work with us to make this area safer. The culture of Silver Spring is one of inclusivity and appreciation and concern for neighbors. For nearly 2 years, elected officials, the community, businesses, and MCPD have been working to put systems in place to promote communication, encourage cooperation, and educate businesses on better ways of crime-proofing their operations. The late night safety bill is another step in creating a safer community for everybody. And I want to talk, I guess, on the budget a little bit now. This process is not going to end with the first straw polls. The council is very close to voting on the FY24 operating budget. Last week, they made it clear there will be some changes to my recommendations for the operating budget. That happens every year, not surprised. What's not clear yet is where the council is going to land on funding the school system and some of the priorities I recommended. I want to urge the council not to make sweeping cuts to the budget that include things like continuation of some very important services that our residents need, services that, you know, we saw essential during the height of COVID. And now that the state and federal government are pulling out of support, this is not the time for the county to pull out its support as well. Nobody's debating that the pandemic of COVID is over. It is no longer in the place it was before. It's not causing the closure of businesses, massive layoffs, or any of that stuff. But we still know that jobs have not recovered. Hours of work in many cases have been reduced. Staffing levels have been reduced in many places. So many people are unemployed, and often the unemployed are in the service economy. And these folks start at the lowest incomes, and to any extent that this is continuing to burden their ability to, you know, make ends meet, things like food become really important. And, you know, I know the council looks like they're going to use our FEMA money for food and take it out of the budget. That's fine, but, you know, our thought was to put $6 million in the budget for food and be able to go to FEMA money or the reserves if we need to, in case that food money runs out. There's no indication, it hasn't been any indication this year so far, that the requirement for food in our community is actually reduced. I think it's one of the barometers of post-COVID America is that we still find ourselves providing more food than we did pre-pandemic. And so I hope whatever is done with that enables us to have the flexibility to increase funding as needed. There are other areas where, you know, funding is going to be needed. We provided a lot of rent support. We had enormous help, particularly from the federal government. That's gone. We're still going to need to provide rent support. Not providing rent support will result in evictions. There's no other way to put it. If you're in that low income category already, we're talking largely about people paying 50 to 60% of their income on rent. If they are rent burdened and if they are delinquent on their rent because they simply don't have the income now to pay that rent, if we're not providing adequate support, then many people are going to lose their housing. That's real, and I think people need to at least ponder the impact before they cut too deeply in this area. The property tax increase that I proposed was to fulfill the MCPS budget request, plain and simple. I supported it because the request was primarily about increasing pay for teachers and other staff. At the same time, from the very beginning, I met with council members to show them how 3 or 4 cents of that increase could be mitigated by rethinking some of our outmoded and frankly unnecessarily burdensome budget policies that could produce savings this year and going forward. We proposed what we proposed largely within the constraints of what we knew the council's preferences were. But if the council were to rethink a couple of things that wouldn't result in any cuts in services, at least not any cuts for the pennies that you save, we could preserve more of the services and more of the things we're trying to move forward without resorting to making deeper cuts in the budget. I preferred using money that we already had in hand differently. In other words, I wouldn't have had to raise this money. This is money that's coming into the county right now and is not going to be used on anything right now, and that we could have used and put into this budget. And the council appears to be choosing not to do that. And I think that is preferable to reducing services and programs that we know residents want and need. I think telling the schools that they can't sequester their own separate reserve funds was a good step. I supported the council in doing that. I think it's the right thing to do. And the school system is stubbornly insisted they should have their own reserves, even though the charter says they shouldn't. And hopefully telling them they don't have the money for the reserve fund will result in them not putting the money in the reserve fund. And I'm glad we reached an agreement on how to tie up, how not to tie up money on lapsed positions or vacant positions that we know we're not going to spend this year. And I will say, honestly, we had a hard time coming up with a way of doing it that we thought the council would accept, because we had proposed this in an earlier budget and the council didn't like the liberal use of lapse to preserve these positions. The council in this case has decided to go more liberally into the laps. And this is not going to harm the county. There are positions we know we will not fill every vacant position this year. And on our part, we already directed our department heads to focus on hiring for positions where vacancies are causing work not to be done or putting an undue burden on existing staff. We have staff that's being forced to work overtime, forced holdovers, or being asked to do more work than they can reasonably do because we don't have adequate staff to get the work done. And, there are a lot of people, and I call out our folks in the social services department who are carrying caseloads beyond the caseloads they should be carrying. But nobody's sitting and saying, I'm only going to carry the recommended caseload. People are out doing the work they need to do to the extent they can do it. So those are positions we want to fill. When I started, 4 years ago, I wanted to embark on a program to restructure the county government. And it's amusing listening to council members say, well, you said you were going to do this, as if there had been no COVID. We started about down that path, and then COVID came along, and we've had 3 years of this COVID nightmare. And in the first 2 years, people either weren't at work or were doing often jobs that they weren't originally hired to do in order to keep the county afloat. We weren't in a position to go through a restructuring process that actually would have engaged the workforce, because we didn't have a workforce as we had prior to COVID. Now, as we come out of this, and we're still victims of the Great Resignation. So I appreciate being dismayed at the number of vacancies. I am too. But when you look around and you hear that Fairfax County's vacancies are 15%, you've got major vacancies in companies, you've got major vacancies in every government. The state of Maryland has massive vacancies. We're in a period where everybody's trying to deal with vacancies, and people who left work and are not coming back, people who decided to retire early and not to work longer than they needed to. COVID probably reminded people of their mortality, and maybe it's not always a good idea to work till you die. Maybe there's, a place for enjoying some part of your life after you finish working. So for a lot of reasons, we've been faced with a Great Resignation, and what happened to Montgomery County isn't any different than what's happening around us. But we're going to take advantage of this, and as the departments move forward, we're going to have them work on how we restructure to see if a combination of greater skills, better deployment of staff, and better use of technology can lead us to being able to meet the needs of our residents, while somewhat reducing the number of staff that we need to do this. And I'm optimistic we can do this, and I'm optimistic now that we're in a position where we can actually do it. Would argue that the large number of vacancies are a blessing in disguise, because this gives us the opportunity to really rethink things before we fill positions. And if we were 100% staffed and we were to do this work, any savings inevitably would have resulted in a loss of employment for people. We can most likely do a lot of this without having to retire people and or fire people would be probably more correct word for what we'd have to do. And so I think this will be an easier environment to work on, and we're committed to getting this work done. And so I appreciated the council coming up with a number that doesn't handicap us, but allows us also to realize more savings, and something I agreed with, and I'm glad we found a way to do it that works for everybody. We're in our first normal year now, so it gives us the opportunity to really rethink how we go about our work. And as I said in the beginning, the education budget was the crux of this budget decision. This is probably the thing that gives me a little bit heartburn going in today. I'm glad that the council funding is intended to support teacher pay, which is sunk to the point that we're not competitive in the state or in the region, particularly given the high costs of living in the state. We no longer are the highest paid jurisdiction, though we are the most expensive place to live. And the District of Columbia, right next door to us, a short drive away from much of Montgomery County, is up starting teacher pay to $75,000. And even with the salary increase, starting teacher pay will approach $58,000. So we're under pressures from jurisdictions around us. And so raising teacher pay was important. And I was also agreed with the council on pulling away the reserve fund that the school system once again insisted that they should have their own reserve fund. They should not have their own reserve fund. The charter says that the county's reserves, which are fairly enormous, are reserves for every county agency, including the school system. And the idea that they feel they can carve out their own reserves is just not warranted. We act as their reserve. If there's an issue where, they need to go beyond their budget and they don't have savings in place during the year, then this is where they turn to the county. County's always been supportive of the school system. We know why these reserves are there. So I don't picture us saying, no, we're holding on to our reserves, too bad. So hopefully they'll adjust to this. But I am concerned a little bit about the council's decision on two other large tranches of potential cuts that could add up to close to $45 million. While I shared their concerns, and I've been vocal about the lack of accountability and transparency in school budgets, this isn't something new. This goes back decades, as well as a lack of a meaningful role for the actual educators in thinking about where resources are most needed to improve instruction. I'll point out that we're now funding schools at a per pupil rate that is 80% of what we funded our schools at in 2010. And not all of that difference is pay. Some of the difference is where money goes in the school systems and support for schools. I can only, tell you from my own experience as a teacher, I started out with having an 8 in my classroom for most of my day. I ended having an 8 in my classroom for 45 minutes. I taught a highly diverse and highly socioeconomically challenged class most of the time. And losing aid support in a classroom was a real blow to being able to deliver instruction in a classroom. I think all of us know that not everybody has the same language fluency or math fluency. And the challenge of teaching a singular lesson targeted to grade level to students who are at a wide range of grade levels. My own 5th grade classes at times had students reading at the kindergarten to 2nd grade level and students reading at 5th and 6th grade levels. One lesson doesn't fit all, and so staffing really matters. And so cutting money without knowing where this is going to go, just saying we could cut 22 or we could cut 44, 2 tranches of 22 million, it may not be the exact number they're using, but something like that, without knowing what's going to be lost, is something that ought to be concerning. If they couldn't get clarity from the school system about what the choices were in cuts, so that the council could tailor their cuts more to what all of us might agree is fluff versus what are key positions that you need to put into the classroom to teach kids, I think it runs the risk of wielding a sledgehammer where a sledgehammer isn't appropriate. We're not going to open up the schools this year to a full discussion. That's not something we've been able to engage in, but I hope that the council and myself will work with the school system to have very different discussions. I hope, and on my part, I will insist that educators be part of these discussions. They have their own views about school spending, and I think it's worth being heard. And I think we've got to collectively think about how we provide the best resources and the most resources, but also the most effective programming and support for the schools. And I think that just saying I could cut the schools by 22 or 44 million without knowing what you're cutting is not a good approach. At least in the county budget, you know that you're not going to hire this person or you're not going to initiate this program. In the school budget, if it's just a dollar figure, you don't know what you're going to lose for the money. And that's not a fight I would have or a problem I would create this year. And finally, I'd say that, I know Evan Glass has raised this issue. I raised it during the legislative session, and I raised it with other county executives. I think there's going to be almost all of us going to the legislature asking for some greater degree of oversight over the school system. I don't know if everybody listening understands the current process, but right now the county is obligated to fund maintenance of effort, which means simply we have to give the schools the amount of money they had last year, adjusted for population growth in the schools and inflation. And that's it for the county. There's zip, zero, none, nada oversight over how that money gets spent. And I think everybody in the state is frustrated because these requests are very large. Everybody's struggling with achievement gaps and progress. And I think it's time for giving the government a larger role than simply writing a check. This is half of our budget. And for no other department in the county would I simply say, I know what you're doing, here's a check, go do what you do. We oversee everything else and we have no role here. And there ought to be a role. So hopefully this is a change that'll be long-term, but this is really all about investing in our students and our community. And the better our schools are, the better it's going to be for all of us. And I'm hoping the county council can find savings in budget to help them keep our school families and future in mind. And we're not going to balance this year's budget on several one-time savings. We're not going to balance next year's budgets because, you know, if we just rely on one-time savings from things we think ought to continue, it's going to be a bigger problem for next year. The cuts we've suggested would have been effective this year and would have carried over into next year without a negative impact. So I hope that in the last waning days of this, there's some thought given to that. But there are a lot of things we got done in common and a lot of things we share with the school system, with the county council. So I think, you know, much of the work they've done is pretty good, and looking forward to getting this over the finish line. A couple of last things. On Sunday, we continue our monthly celebration of Asian American Pacific Islander Heritage Month with a county celebration for the whole community. It's going to be held from 11 to 4 p.m. at Seneca Valley High School in Germantown. And the event features cultural performances, crafts, and games for kids, and a cultural and community bazaar. Many county groups are responsible for coordinating the event, including the Asian Pacific American Officers Committee, the county's Asian American Health Initiative, and the Chinese Cultural and Community Service Center. And before we get to our health update, I just want to point out that earlier this week, I transmitted to the council my nomination for the next director of the Department of Health and Human Services. And I want to thank Dr. James Bridgers for filling so many roles in our public health responses over the last few years. And I feel very comfortable asking Dr. Bridgers to serve as the director of the Department of Health and Human Services. There will be a public hearing for him on June 13th to finalize the appointment. And I'm very optimistic that the council will concur with this appointment. In COVID-19 news, we saw a few blips in our case rates over the last week, but the spikes quickly dropped again. Our hospitalization rates and the percentage of beds being used by patients still remain pretty flat, and our community status remains low. Now that the public emergency for COVID is over, we're in a waiting game to see how the state will share its data on cases and hospitalizations. No matter how often they update their dashboard, we're committed to sharing as much information as we can with the public about the virus's impact on Montgomery County. And this week, we'll wind down our final vaccine clinics at schools and focus on appointments and other outreach opportunities. And with that, I'd like to bring Community Preparedness Manager Sean O'Donnell on for this week's COVID update before we take your questions. Thank you all very much.
Thank you, Mr. County Executive. So as we've now left the declared emergency portion of COVID, we'll continue to track the surveillance of what's going on globally, nationally, locally. Some of our reporting data that's available to us is being shared from state and federal partners at different intervals than it has in the past. One thing, as we track the variants, they're now being reported in 2-week blocks of time, so less frequently. Previously, it was weekly. I don't believe this will make a huge difference in how we're seeing these variants. We do have pretty good knowledge looking internationally and looking nationally as we see them emerging. As our county executive mentioned, we had an increase of transmissions last week. Those have now come down to where they were previous to that. And our hospitalizations, again, have not shown any significant increase. They're at a very low level. To give some context, as we're coming out of this 3-year response, I'm sharing here the Maryland case rates and the Montgomery County case rates. You can see the very large peaks we've had during some spikes in transmission. And these are, of course, what we've been sharing with you is PCR data. We know that after not this winter, but the previous winter, as we're coming out, rapid tests, home rapid tests became much more available to the community. We and the county distribute them at incredible levels, and we still make them available, which did suppress some of the data from here. We were aware of that. We planned according to it. And you can even see at the very, very end of this chart, that little blip we had over the last week or two and the context of where that is previously. When we look at hospitalizations, which has shown more significant illness that's happened, you can see while this past winter had a limited uptick in cases, the hospitalizations chart showed a more significant increase. So again, this has been and continues to be a very important piece of surveillance data that we track. You can see how those have fallen off over the last few months. And even with this latest blip in transmissions, it has not really affected significant illness, which is an important part of how the community's response to this new disease, COVID, evolves over time. Looking at our emergency department visits, we haven't seen any significant change in the total number of visits. And looking at respiratory illness, we have not seen significant increases in those either. So again, we have the same number of patients reported this week as the previous week with COVID diagnoses. We know the hospitals are no longer required to test every patient who comes in for COVID, but our hospitals have assured us they are testing all the symptomatic patients, all those who report contact with a COVID case. And if patients are sharing rooms, they are testing all those patients. Again, this is for safety of the patients and the staff at those facilities. Deaths, again, we have not passed a threshold of 10 in this month. And we'll continue to look at hospitalization and death data by vaccination status. We've seen those individuals who are fully vaccinated, those individuals who are boosted, have the lowest rates. And this is, again, consistent with what public health has been telling the public. Please get boosted. Please stay up to date with your vaccinations. And then finally, we continue, although this is our last week doing a vaccine clinic at Montgomery County Public Schools. We want to thank them for incredible partnership. Our colleagues over there, Stephanie Izzard, who's helped us the past few years, and all the folks at MCPS who have opened their doors and let us do clinics so that we could get to families throughout our community. It's been a great partnership. We really appreciate everything they've done with us and for us. We continue to offer vaccine clinics at Dennis Avenue, at our Up County Regional Service Center, and then also, depending on the day, at Montgomery College Rockville campus. We've been doing clinics at our rec departments where there are senior programs, and we'll continue to do that on specific dates. We've been coordinating with the rec department on dates when they have the most seniors coming to visit. But again, we know most people are going to their private providers or going to pharmacies or going to urgent care. With the end of the COVID emergency, please check with your healthcare provider or your insurance company. Many of them are now requiring you to be in network to have that covered, just like anything else that you receive through, that's covered by your insurance. So please check with them. We don't want anybody to be surprised or have to pay for a service that's actually covered, just depending on who you go to. Of course, if you do come to one of the county clinics, we don't charge for any of those services. Those are all the updates I have right now. And at this point, just like to see if any of my colleagues have anything else to add to this week's report.
Thank you, Mr. O'Donnell. I just want to thank the county executive for his endorsement and nomination of me as the next director of the Department of Health and Human Services. I look forward to working with him and his senior staff, such as Dr. Stoddard, and our senior staff, such as Dr. Davis, yourself, and Dr. Rogers, who's on the call today, to continue our mission of providing those much needed services in the community from the Health and Human Services Agency.
Okay, with that, we are now reporters ready to take questions. I do have a question in the queue, a couple of questions in the queue, and the first one is from MCM. I think it's you, Suzanne, who has the first question.
Thank you. Mr. Eldridge, I was wondering, do you plan to talk to the legislators about changing the way the school budget is handled?
I'm
Will
gonna
you be trying.
Yeah, the first people I'm going to talk to are the other county executives to see if we can get a unified approach. I mean, I know everybody was concerned. I sat at the table, and I got to say, it was interesting. I was with both Republican and Democratic county executives, and what was fascinating was the Republican executives acknowledged the need to fund teacher pay and the need to fund the schools, and simultaneously a concern about not being able to ask any questions or have any input into the school budget. And so I think we all share kind of common concerns about, we know this is necessary funding. Nobody's trying to escape from funding schools adequately. I've been very pointed about pointing out that we've actually reduced our funding of schools in real dollars over the past decade, but accountability is a very different issue. And if you think, to be bluntly honest, we have a school system where we have talked about closing the achievement gap for nigh on 30 years. That achievement gap is pretty much still there, particularly in the African-American community. So we need some serious community-wide discussions around education, because obviously there are more things involved, and it may mean, and I frankly wouldn't be surprised if we wind up in broader discussions about what the government's role needs to be in terms of preparing kids for school. But that's to be determined. But it ought to be part of a holistic discussion about how do we get better results for our children. And I don't mean test scores.
Thank you.
All right. Next question is Kate Ryan.
Thank you so much. First, I want to chime in or hop in. I'm late here, but to the health officials, I had a question about this report from Maryland's Department of Aging, and perhaps you were addressing this. Again, forgive me, I came in late. But there is a tweet from the Maryland Department of Aging alerting folks to a scam relating to COVID tests. That if you receive tests you didn't order, do not accept them or give out your Medicare number. Are you guys aware of this, and what can you tell folks so that we can help them be aware of what this is?
Good afternoon, Kate. I have not heard anything about the scam. I will follow up with Dr. Brunetto, who is the chief of our services, aging and disability services, after the call, and ask one of our public information officers to follow up with any additional details. We have not heard, or I have not heard anything this morning, and Dr. Davis hasn't advised me. She's on the call, and I won't speak for her, but we haven't heard that yet.
Yeah, I'll say I haven't heard anything either. I will say, just in general practice, it's never a good idea to give out someone's Medicare number unless it's directly to the treating provider. And so if people are that is a kind of known scam for our seniors to ask for their Medicare ID number. They shouldn't be giving that out on the phone or to somebody that is unknown to them.
Thank you. I know it's one of those things that can seem confusing, like, oh, I guess I'm supposed to. And, any one of us can fall victim to these easily. So that's why I ask. While I have the health folks here as well. I'm sorry. Yes, go ahead.
I just want to add that Medicare does cover testing for COVID, and they'll continue to cover it. And so that can be confusing. But to our knowledge, they're not going to reach out to individuals who belong to Medicare with an offer for this. So it'll be up to those individuals to look for testing on their own. So it's like a lot of other scams. If you're contacted by someone claiming to be from something, that may not be true. But but we do want to make sure people know they can still have testing covered by Medicare, but there will be nobody from Medicare reaching out to them about that.
Great. Okay. I appreciate that. And Dr. Davis, while I have you, Dr. Bridgers was there the other day as the school system announced this new policy where, yes, kids can have Narcan with them. It is not a violation of any school rules. Obviously, they want the kids, if they do dispense this, to notify health officials there. Can you talk a little bit about the import of this? And I bring it up because as a former teacher, I know that kids want to be sure when they do something like this, they want to do the right thing, but they're not sure if they're going to get in trouble. Can you re-emphasize this for us?
Sure. I think we want to emphasize that there is the Good Samaritan law, and that anybody that is giving Narcan and saving a life will not be prosecuted. That is, we want to do that, and we have seen that in our youth in several examples where youth have stepped in to help their friends in giving Narcan, and we want to applaud that, to give the Narcan and then call the authorities, because we know that just giving Narcan sometimes is not enough. And so I applaud the school system for taking those steps to make that, to put that regulation into place that folks can use it. We feel reassured because there are no side effects for giving Narcan to someone who has not had an opioid overdose. I want to reiterate that. I think that sometimes is the concern. Well, what if somebody is passed out and you give them Narcan and it actually was some other type of medical emergency? Will it do them harm by giving them Narcan? It will, and it will not. And so that is also very reassuring. And that training is available. We want folks to get that training. It's available on the website. There are lots of opportunities to get that. And so we applaud the school system for doing that. And we, applaud the kids who are being good Samaritans. We also recognize that there's a double-edged sword. We don't want people to now participate in riskier behaviors because it's available. We really are trying to save lives. And we know that Narcan saves lives.
Thank you very much.
Yeah, I want to actually add to what Dr. Davis says, because I was actually going to comment. I've seen a lot on social media saying there's been some pushback saying about giving kids Narcan and the presumption that we're supporting behaviors. Just as we've talked about in sexual education for a long time, abstinence-based sexual education does not work, which is why you can teach about the risks of teen pregnancy and sexually transmitted diseases concurrently with giving out condoms and other prophylactic and protective implements. And that's been a well-recognized thing within sexual education. Harm reduction is an important component of the preventive process. And so just because we can speak about the dangers of fentanyl abuse and prevent the strong desire to prevent adults and adolescents from being exposed to fentanyl doesn't also mean that we can't concurrently be of the same mind that we want to protect people from dying who happen to use and give us more opportunities to intervene in that young person's or adult's life to get them out of addiction. So we can be of two minds and we can think about two things at the same time. And it's an okay thing for us to do. And we very much support the school system's efforts to do that.
Thanks. Yeah, the police pointed that out as well, that it's about saving lives and re-emphasizing that's the first order of business. If I can switch gears here, and again, forgive me, I'm coming in late. I think Suzanne was driving at this. Mr. Elrich, the way in which the school board, when they were before the council, talked about how they might not be able to fulfill their contracts if they didn't get fully funded, gave the impression that the council has some kind of authority over line items in the school budget. They do not. Is that correct? Can you?
They have no authority. When I was on the council, we tried to direct money on a line item basis, and the school system just moved the money. But this is really distressing. I mean, if the school system's looking for a war, and they think that if the council says they want this money going to teacher salaries, and they go put it in someplace else, particularly consultant contracts and stuff like that, I'll be clear that, I'm going to be siding with the council on that. The teacher priority is the biggest problem the school system faces. The inability to compete on salary, the inability to fill spaces. Nobody wants to talk about it, but this is happening in real time. There are classes in Montgomery County where if a teacher is sick and is out, and can't get a substitute, they are combining classes together because they don't have the substitutes who are available. This isn't the fault of the school board. It's not the fault of the superintendent. It's reality, but part of that reality is the ineffectiveness or the uncompetitiveness of the salaries we have. And I think there are some other issues, but they go deeper into, I think, what I was getting at before, the role of teachers and as professionals in the school system. But the school system should not test that water. They could win that battle, but they're not going to like the result. I think that would be the thing that would lead us in front of Annapolis and make it even easier, because one thing that the state school board has been the arbiter of salary disputes, and I can't picture. I'd be really surprised if the school board, if the union were to take a fight to the state school board, whether the board would uphold the local board, because they clearly were given the money for salaries. So my recommendation is this is not a fight you want to get into.
And then with tomorrow's vote, it's a straw vote on the budget before the council.
Right.
Have you been given any indication as to whether or not they will actually go for the full 10-cent increase on property
But
tax?
I know they're not going to do the 10 cents. Like I said in my comments, there were ways from them that I tried to show them they could bring this down 3 to 4 cents. That was a piece of cake. And when you throw in the reserves that they're not going to let the schools have, which I have no problem with either, then my 3 or 4 cents becomes 4 or 5 cents. But I proposed doing things that I knew the council would not have been happy with, so I didn't bake it into the budget. But they are things that involve money we already have that is actually doing nothing. And that money could be used to fund the needs this year, and it could be used to fund needs in the future. So there are other ways to get there short of doing this. And that's why I would bite it and go another penny or so higher, or take our suggestions on either reserves or OPEB to go a little bit higher in terms of what we use, rather than make cuts to the school budget that they really don't know what those cuts are going to be. I mean, not only can't they direct the money toward salaries, but if you cut 44 million, they don't even have the ability to go in and say, this is how we're going to build our 44 million. If they were doing that with the county government, and in fact, they do this with us, and we do it ourselves to ourselves. When a department comes in front of me and says, here are the things that we want, I can look at a list of things and say, well, we can't fit this in, we can't fit that in. The council, in the cuts they're making, says, well, we're not going to do this, we're not going to do that. They don't tell the county government, you're not spending $44 million on county government operations. They make specific decisions. They're not able to do that. I thought they had enough information from the school board about what they were going to do with the amount over teacher salaries to say, we want to fund, for example, the special education teachers, but we're not funding any of this other stuff. And that's, if I'm not doing it, but if I was doing it, I would focus on either learning really quickly what you could tell them you don't want them to fund out of either what's in their budget request that's over last year or what's in their base budget. But to just say you're not spending 44 million, I think it runs a risk of either going into the teacher pay or going into things that are going to further harm. And in fact, that's what the school system threatened us when Jerry Wiest was, I think it was Wiest was still president of the board, was still the superintendent. They sent out a letter of parents basically saying, if the council doesn't give us money, these are the things we're going to do. And they picked all the things that would hurt students. And, out of a $2 billion budget, the idea that you would pick only the things that parents would see as hurting students and not your consultant contracts. I've seen how low they've gone on this in my own personal experience. I haven't seen that with this superintendent, and I hope it doesn't get there.
Got it. And then a last question, because I know there are others who have questions. In terms of the business interests that have sent a letter saying, everyone from Carr to Bizzuto, et cetera, saying that this is a mistake. What's your sense there?
It's the same thing. There's never the right time. And, I'll just say this, they're fundamentally not honest. When I look at a G-Car thing saying that raising taxes is going to make housing less affordable, they don't say, oh, by the way, Montgomery County has the lowest property taxes of any jurisdiction around here. So everybody else must be stunningly unaffordable. And in the commercial sector, the idea that raising this tax is going to make us non-competitive is utter nonsense. If they were in Fairfax County, I don't know how this last change in Fairfax County plays out, but for a while, Fairfax County's tax for development in Tyson's was $1.65. And I think right now, after they finished their budget, it'll be down about $1.59. That said, ours is 99 cents. If you had raised it a whole 10 cents, we would have been $1.09. If you raise it 6 cents, it's $1.05. We're nowhere close to the commercial taxes in Virginia. We're nowhere close to commercial taxes in DC, where they go up to $1.89. So this crap, and I'm going to call it what it is, which is crap, that somehow we're doing something that's going to make us non-competitive is a bunch of nonsense. And what makes us non-competitive is if we had a taxing structure like Fairfax, where more money goes into the Fairfax budget from the private sector than goes into the Montgomery County budget, we would build the infrastructure, which is the thing that gives Fairfax an advantage over Montgomery County. Being able to build the Silver Line, not just the Purple Line. Oh my God, when that's going to happen. But the Silver Line, which is a far more important route and a far more important transit project. The fact that this county can't do that my budget doesn't have money in for, financing BRT over the next 5 years to build it out, is indicative of what happens when a county government is under-resourced. So if you're looking at Virginia and looking at all the things they have and saying, why don't we have it? You ought to look at how differently they tax the corporate world than we do, and how much more willing the corporate world is there to make investments in the kind of infrastructure that builds the Virginia economy. It would be nice if they would be as supportive over here as they are over there.
Thank you very much. I
I
appreciate
know I
it.
went on a little bit of a rant about this, but it's really irritating because this argument from them is totally disingenuous. And that's the nicest thing I can say about it.
Got it. Thank you.
All right. Thank you, Kate. Our next question is from Jenny from Moco 360.
Hi, I have a question for you, Mark, about there's this letter that we've seen from the Attorney General's counsel to the General Assembly about planning board appointments and how these have to be
Yep.
Okay, you know what I'm talking about. You cannot
Yep.
be sworn in until the 30-day veto period. I was curious, obviously, there was a bit of a stir because you had vetoed a member, and I was wondering, was your understanding that people were sworn in before you were able to complete that period? Do you think that the council violated anything?
Yeah, they were told they were violating it and they still did it. So
can you elaborate on who they were told by? Told by you?
They were told that we were supposed to have 30 days. And they just decided not to. This is not the way things are supposed to work. So I don't believe I'm going to veto either of these two appointees. So it'll be a moot question here.
But in the previous,
but I'm not going to do it. I'm not going to interview them within the next 3 days. I'll get them interviewed within the next week, and I'll let the council know within a week to 10 days. But it was absurd when the law says you got to wait. You have a 30-day period for a veto for them to do what they did. Maybe all the council members didn't realize it, but I know some of them did.
so in the previous group, not this, I'm not concerned about these two that were just appointed yesterday, but in the previous group that was appointed in February, they were sworn in prior to you being able to give your feedback.
Yep.
And was it your office?
At least let me interview the people. It wasn't like I delayed the interviews.
Mm-hmm. And it was your office who advised them that they were not supposed to do that.
Yeah, we read the law. We have people who do that.
All right. Well, thank you.
Thank you.
Are there any other questions from the media? Any other questions? Going once, going twice, going 3 times. Thank you everyone for your time, and we will see you again next week.
Thank you very much, everybody.